So let's get started. So what I want to start with is our goals tonight are certainly what we want to look at, and hopefully you will all get something out of that. What the first goal we want to make sure we clear is understanding AI and the different applications in dentistry. The key ingredient to maximize your day, ingredients. I will present basically 5 ingredients that will help maximize your day. Communicating with AI and treatment planning with the patient and increasing case acceptance. That's what the bottom line is how do we share with patients an unbiased opinion that, in the past, they've always seen it as being biased as owners of the office or as doctors because they know there's no question we have in many situations a financial investment. And in the past, there's no question there may have been some doubts as to the treatment plan that was presented. First of all, I want to provide a disclaimer that at no time have I have any ownership in any of the presentation that I present. I wish I did, but also I'm a Catapult Education member as the leading global education at this time online. Catapult is an organization that was started many years ago by Dr. Lou Graham, and we also evaluate. We have about 30 speakers, about 30 people additional that do product evaluation. And if, for instance, a company might ask us, evaluate this composite we sell, and then we'll evaluate the stickiness, how it adapts to the walls, the stability, the color. And if it gets approval by a majority of us, then it gets a vote of confidence, Catapult confidence, which they can use for marketing. So this is Pearl. You may want to write this down, hellopearl.com. And Sheela, who is providing this webinar tonight. And Pearl, I've been involved with, like I said, for 5 to 6 years. I wish I had ownership, but Pearl is made up of basically practice intelligence, which is more like the office management side of AI. And then the second opinion, it's just what it says. It's a second opinion when it looks at your x-rays that you take. So one thing we want to do tonight, and I always do this in my lectures and webinars, seminars, is we want to share and most important, have fun. We want to share. That's how we learn. These are my favorite animals. So Einstein said, let's think. We don't need to think more. We need to think differently. And in my extreme number of years, let's say, I've seen tremendous change. I was sharing last week when I was lecturing that when I graduated from dental school, I had to know about 25 materials. Well, there's no question that perhaps in a month we'll see 25 different materials. And as a lecturer and dental educator, I have to stay on top of that. So dentistry has changed in many aspects: presentation, our x-rays, our materials, everything. And it's just advanced, so that the ultimate goal is to provide better for our patients. When you wake up in the morning or you get up every day, AI is all around us. You cannot turn on a TV station nowadays or watch the news without perhaps AI being presented all over the screen, on the radio. It's all over the place. Driving to the office. Just this morning, there's a truck, AI for your home. So we know, and many of us already have AI in our homes and in our lives, even if you don't have it in a dental office. And that's my ultimate goal tonight, is that you will see the advantage of it. And as Andrew Nag, who was a co-founder and head of Google Brain, said, AI is the new electricity. It will transform every industry and create huge economic value. One of the things that I try to get across to dentists and talking to them personally is AI doesn't eliminate the dentist at all. AI provides an insight to what is possible when it diagnoses or when it looks at your x-rays. What is possible when you have a cancellation? And I'm going to share that with you tonight. So what is AI? It's a computer systems that can simulate the problem solving and decision-making capabilities of the human mind. It's kind of a brain within a brain. And so it can take these problems and solve it. And believe it or not, many of you already use AI without even knowing it, perhaps. And how do they do this? Well, what is artificial intelligence? And this is in my own words. In the old school program, programmers would write code to tell a computer what to do. This is still done. So many of us have dental software, or we have some type of software in the office that helps us on a day-to-day basis. Well, a programmer said, okay, so if you click on a patient chart up in the upper bar, it's going to take you to the patient chart and demonstrate perhaps charting that has taken place. If you tell the tooth that you diagnosed a crown, it by clicking on it, it places a crown. So a programmer had to do that. Now, in addition to the programmer writing the code to tell a computer how to learn what to do, the way it does that is by showing many examples of what to do. This is AI algorithms. That's what they're referred to. So programmer still writes the programs, but in addition, what happens is the programmer will give many examples to the computer to learn what to do. So it's pretty exciting. So that's exactly what AI algorithms are. It's a set of instructions or rules that enable a machine to learn, analyze data, and make decisions based on that knowledge. These algorithms can perform tasks that would typically require human intelligence, a human decision, and recognizing patterns, understanding natural language. And for many of you, I'll give you just one example, is that if you have Siri, Alexa, we have that at home. How about when we're away from the house, you can control your thermostat or your Sonos bar by speaking to it. So anyone that has an Apple phone or an iPhone, they know, hello, Siri, and you can ask Siri all kinds of questions. There's functional AI, which is our robots. There's analytical. That's what, for instance, our schedules and x-rays are read in the dental field. It can also help us monitor our patient records. And I'm going to show you that tonight. Generative AI. We all know about chat, where there's CVs being written for people that are applying for jobs, or open AI. Also, there's different, situations where they can take AI and solve problems. So one of the things I like to share with you is OpenAI took the bar exam and did better than 90% of the attorneys that took it. So it can range in a number of different ranges. Visual AI. One of the apps we have is that my wife can take with her AI, point it at a plant, and it will tell you if it needs water. There's an app that tells you. Or take a picture of the grass and tell you if it needs water. It can take a picture of an apple and tell you at what stage of maturity it's at. So it's amazing, just amazing what this has turned into. So if we look at the history of dentistry and we go back many, many years to 1800s, you can see AI is like the new electricity. It's the new topic in dentistry. And it's very exciting. I always say when I'm presenting this in lecture, thank goodness for high speeds. We no longer have the belts. So technologies that will drive the future of dentistry. Today's practice has to be focused on embracing technology and integrating it into an efficient workflow. There's no question. Just as we went from paper charts to electronic charts, that's change. And most of the time, change is good. I have a saying, if you don't change, change will change you. So when asked, what percent of patients say it's important for dentists to have the latest technology? And the response was 87%. Our patients today are very, very smart. There's no question. In fact, when we have an emergency in the office, many times I'll say, they'll tell me what's going on. They say, well, I looked this up on Google and this is what I saw. So I always ask them, if they don't say it, well, did you go to the most attended doctor that we have in the world? And they say, what are you talking about? I said, did you Google this? And believe it or not, majority did. So not only do they Google that, but they Google procedures that we do, so if it be a filling or a crown prep. Then they were asked what percent of the patients they would be more likely to choose a dentist that uses advanced technology, 77%. Again, they want the latest and the greatest. They want to make sure that their care is on the up and up, that they're getting the best possible care possible. So I have said that within the next 3 to 4 years, and I think it's actually now, from what I see and what I get to see, is it's going to be within the next 2 to 3 years, AI will be essential utility in our dental profession. So let's take a look at some of the places where AI already exists in dentistry. Oral surgery, third molar extractions. It helps. We no longer see the paresthesia that we used to see with just a panelete or just a PA. For years, we had no idea how to read that because it was two-dimensional, even with a CBCT. So now, which, by the way, we're working on getting AI and a CBCT in the dental office. Does that eliminate the oral radiologist? Not at all. And how about this study, orthodontic surgery, where 30 pre-treatment facial images of orthodontic surgery cases were evaluated by surgeons, and they predicted post-surgery facial images were produced. They took an AI model that was applied to the predicted post-surgery results, comparing the actual post-surgery images and pre and post-surgery, post-AI modified, and it was predicted facial images proved that AI intervention enhanced more than 80%. That's amazing that we could take, and we all know orthodontic surgery has a high and certain ones have a relapse and the possibility of not coming out the way you want. But just to think that this 80% enhanced that off the predicted. Periodontics detect periodontally compromised teeth. There's a study going on in pediatrics, AI application of detecting dental plaque in 73.6 to 99%. Wouldn't it be amazing if you could take a light at home and not just the the little tablets we use, disclosing tablets in the office, and you just shine in there and see plaque, how that would improve patients' brushing. Identifying bone loss on x-rays, and you'll see that tonight. And how about if any of you have Florida Probe, voice assistance, where the speech recognition as you probe. Orthodontics, this is where many of you already have used this without maybe realizing. Cephalometric tracing and interpretation for our orthodontists, or if you do orthodontics in the office, you want to see where certain landmarks are. They analyzing growth patterns, predict orthodontic treatment in the future, and of course, the big thing is clear aligners, Invisalign. I will tell you, for many of you that do Invisalign, what happens is you scan the patient. That scan goes to Align technology. And there's no secret, Itero and Align are owned by the same. It goes to their computer over in Costa Rica, and it looks at this. And the AI analyzes and looks at your scan of the maxilla and the mandible and your bite, and it goes, oh, I've seen this a million times. You need this trait, and this so many traits. That's AI. And you've been using it perhaps for years. Endodontics. This is the one that has me very, very excited. Analyzing root canal anatomy, detecting root fractures, detecting periapical lesions. You'll be amazed at how many periapical lesions are missed with our 2D x-rays nowadays. Precise assessment of working length. We will be able to precisely know where to place that filling, that gutta percha, and predicting the viability of dental pulp. Wouldn't that be wonderful? Our pulp testing and being able to analyze the viability, the vitality of that dental pulp, and predicting the success rate of retreatment. You know, I was just at a conference this past weekend with a group of endodontists, and it's like, why do we always plan for retreatment? Well, it's reality. It's a very low rate still, but it happens. So if you are able to take a failing root canal that has been out there for 10 years, let's say, and you could predict the success rate of retreatment, that would be awesome. And I mean that. Dental implants, design of dental implants, an AI model that modifies the dental implants. What it does is it literally looks at the bone and it looks at the length, analyzing the bone and modifying that implant, fabricating that implant to fit to that bone so that you have a success rate. The porosity, the length, the diameter of the platform, bone level, the whole works. It will give you an answer to the implant bone interface, and therefore that will give us a better design implant, and you'll be able to machine that. Identify the bone level on radiographs. And of course, if you do any type of implant surgery, I insist on my periodontist to have a surgical stent so that I can plan the prosthesis whenever we place an implant. It's just a must for me. And of course, the robot Yumi and the placement of implants, they all still need dentists, thank goodness. And let's look at restorative, enhanced crown design with better marginal adaptation. Detection of caries. Here, you're going to see in a few minutes how Pearl works. And of course, computer vision. And that's exactly the science of being able to read something. Whether it be, as many of you know, our modern cars today, blind spot monitoring. When you're almost going to hit someone in front of you, it alarms you as collisions. And of course, dental radiographs. So let's take a look here and a little bit further in restorative. Of course, CAD cams, that's all AI and how it reads. It analyzes the crown beforehand and the fit, the contacts. So what happened, there was a dental AI council forum. They gave 136 dentists a full set of x-rays, okay? And they asked them, one of the questions, tooth number 3, is there, in fact, is there decay? 136 doctors, they asked, is there recurrent decay? So let's take another look. As you look at your monitors there, it's maybe a little fuzzy, but look at tooth number 3. So the results were this: 51.5% said no caries. 48.5% said caries. 39.7% said no recurrent decay. 60.39% said recurrent decay. So yes, we have a judgment. It is an opinion. It's, we're all different. And we already know that you can give a full set of x-rays to 10 dentists and you're going to get a difference. Tooth number 19. They were asked, what is your fee for treatment of tooth number 19? And the results were 26% said $0 to $500. 37% said $500 to $1,000. 21% said $1,000 to $3,000. 16% said $3,000 to $5,000. So here was a result out of 136. Whole mouth treatment, 300 to 36. Average 50% could not agree on some type of agreement. That's the dilemma we've had for years because we're different. We think different. We see different. We have certain limitations when we look at x-ray, and we'll talk about that. So I say we have met the enemy and he is us. And then in 1996, this wonderful, the medical journal of best medical journal of the world, Reader's Digest, a person went out and visited 50 different dental offices, excuse me. From one dentist, I got a quote of $460 for all of the work I needed to be done. From another one, $850. So out of 4 months of 50,000 miles, 50 exams, his remarks, and I'll summarize it, is that dentistry is a stunningly inexact science. For many of us that was in practice then, as I was, we had to do a lot of backstroking, explain to patients. It's an opinion. We look at things differently. And, hopefully you're at a dentist that can provide and educate and give you the answers that is what's best for you. Provide the very best dental health that we can. So when asked, what percent of patients don't trust their dentist's diagnosis? 59%. Remember, I referred to, you have a vested interest in the practice, and they just don't understand. If you don't think that's the case for many of us that do hygiene checks, when you go into hygienist and hygienist said, doctor, please take a look at this. You take a look at it and you might say, it is in your best interest. I'm going to recommend a crown. And then you go on and finish your exam. You walk out of the room. Again, this is all about trust. The patient who sees the hygienist in most situations more than the dentist who trusts says, do I really need this? Happens every day because 59% know they're smart. They know that perhaps I don't need it, but unfortunately, there's been some bad situations where dentists overdiagnose or they hear stories. But all of a sudden, I need a crown. So they look back at the hygienist and say, is that what I really need? 65% of the patients don't fully understand what their dentist points out in their x-rays. And 71% of the patients are more likely to trust their diagnosis if the dentist is using AI. Those are the studies, those were the results when they pulled and asked. So some of the popular AI programs out there, one is Pearl that I'm going to talk about tonight, Overjet, Vidya, and Dental.ai. And I've looked at all these. And the reason I went with Pearl is because the opportunity existed. They were early on. And I looked at the features that were already there 5 and 6 years ago. So some of the popular dental AI available today. There's two important factors when you look at AI programs. One is practice management. It's important to be able to integrate that into your day-to-day operations, diagnostic capabilities, reading your x-rays. Now you can present to the patient an unbiased opinion as to what is being seen on the x-ray, what is seen clinically when you use an intraoral camera, or by all means. Again, I want to present a disclaimer that I only present Pearl because that's what I use in my office. I have no financial investment in it, and it's what I use from day to day. So here's Pearl. It has Practice Intelligent and Second Opinion. So let's take a look at Practice Intelligent. What is Practice Intelligent? It's an assist, and that's what I call it, an assist that helps you in, if you have Dentrix, EagleSoft, but it's the management, perhaps the side of the practice. So here's a typical morning huddle. For many of you, hopefully you all have morning huddles. We have a 25-minute morning huddle every day, and it allows us to set when we're going to have emergency times. What is going on? Mr. Jones, we were a little late last time. Let's make sure that we get him out on time. Mrs. Jones has an appointment that she has to get to. We discuss and take care of it. We go over the hygiene schedule, the doctor schedule. We make sure that we have the next day lab cases, that those been cleared and checked in. So we take care a lot of the maintenance. So the morning huddle, this is what the typical Dentrix morning huddle is. And this is a Monday morning, okay? So as we go through this, key ingredient number one to maximize your day, schedule to production. So we set a daily goal of $6,500, and we block out times to make sure that we do our best to achieve this goal. Now, I teach a business class in dentistry. Dentistry is a business. Let's make no mistake. It's how we pay our bills. It's how we pay our team members. And literally, it's how we make our living. So there is a business side of it. And I'm a very strict business person. I want to be the best clinician I can be and provide the very best. And I think I have over the number of years for my patient. I've always tried to do my best. But when I'm at work, I want to work. I want to achieve as much as I can in that set period of time and provide the very best. So we have a schedule to production goal. So as we're going through our meeting, we schedule accordingly. Now, as we block out time, if those times aren't filled, then we can move things into on patients with short notice. So practice intelligent. So this is what my Pearl morning huddle looks like. Now you will notice there are different colors, and I'll explain that. But what this says on the top bar is there's 10 patients, 5 need x-rays, there's 15 opportunities. Let me explain to you exactly what an opportunity is. What AI does is it says, hey, take a look at this area. This is an area of concern. This is an opportunity. Now, let's get something very carefully understood. AI can be wrong, but yet it presents us with an opportunity. And all it's saying is, take a look at this. I'm seeing this. I don't see this on the treatment plan, or I'm seeing this. It is on the treatment plan. So each color here presents an opportunity. And also, as you notice at the right below the top bar, there's little notations on each person that may be unscheduled. The provider this is the hygiene schedule, the predicted, the full mouth, and the bite wings. It tells you what that patient is due to for. As we go along here, here's the explanation of the different colors. Blue is patients have unscheduled treatment or AI findings. Green, patients no unscheduled treatment and no AI findings. So what happens is AI is going through your charts constantly looking for opportunities at all times. It's an ongoing progression of checking out those patient charts. Gray patients are new patients or patients without images in the last 18 months. You have not clicked on anything. You have not done anything. So if we take a deeper look, here's our schedule. And if you notice there, here's Cordella Fay. Well, Cordella Fay is today scheduled for full mouth, bite wings, and there's opportunities there. It's telling us that. So it identifies undiagnosed treatment, unscheduled treatment, and this is how we enhance our day. Perhaps we have an opening all of a sudden, and we look at this and say, well, this patient shows here there's some unscheduled treatment, whether it be a composite filling or a crown or whatever it may be. We have that opportunity to present that. Hey, while you're here, would you like to take care of that? So it's just incredible reminder. It presents to us what AI sees and how it compares to what's scheduled. So again, here we are looking at the patient, and you see unscheduled full bony impactions on those 4 wisdom teeth. Those are unscheduled. Predicted are AI predicted. Scaling, there's an implant possibility there, a restoration. So these are opportunities that perhaps we have not looked into, or we missed, or at least it's not on the treatment plan. We all get busy. It may not have gotten placed on that treatment plan. Okay. Also, is it perio? Is it a prophy? Or is it an SRP? It will look at your x-rays and diagnose that and say, hey, this appears to me to be an, a SRP and not just a prophy. So again, identify unscheduled treatment, undiagnosed AI, and enhance same-day opportunities. And this is the Morning Huddle printout. So it gives you, as you see here, just as we mentioned, today, unscheduled and predicted. You cannot go wrong with this. All right. So now what happens, we're going through our schedule. And so our office manager, who has been listening Monday morning to the recordings, a message is left, and all of a sudden, bingo, we have cancellation. Anyone that this hasn't happened to hasn't been doing dentistry long enough, is what I say. We know that, and you're crushed. Your team's crushed. You're crushed. This is Monday. Payroll is due on Friday. So how do we make up for our daily goal? AI to the rescue is what I call it. So in our patient intelligence, we have key 2, maximize your day. We have resources to achieve your daily goal. What are those resources? Well, let me tell you, this is the typical picture in most offices. They're called 3M Post-it notes. Call Mrs. Smith for if anything changes in the schedule. You can call me anytime. I can be there within minutes. I don't live that far away. Try to get my appointment moved up. This is what most treatment coordinators' computer monitor and their desk look like. I call it a disaster, but that's what we've had to do for years until we had practice intelligence. Now what you can do is you have a button. If you look to the left there, you'll see the column with the X. These are recently canceled restorative and periodontal maintenance treatment in the last 30 days. That's just one category. And what you can do is you can pull it up by the doctor. You can pull it up by the procedure that is being done, by the insurance code, and by the time that you're trying to fill. So now, just at the push of a button, we have this in practice intelligence. And if you look on the right here, you'll see restoration, replacement, restorations, endo. You can pull it up again by the treatment treatment code or the doctor. It is unbelievable how well this works, because now we can fill that 3.5 hours, 4 hours, whatever that time slot is. We can fill that with a push of the button. So please write down if you have it, and we can eliminate this. So what's another resource we have? It's called a call sheet. If you look down on the left-hand column, your call sheet. And this, again, now I use treatment follow-up a lot. So if I get home and I forgot that patient number, I can pull up on my computer. I can go back into the office computer and pull that up. It's right there. And also, we have overdue, due now, visiting soon. These are all areas that have our patients where we don't have to go through multiple, try to think of a patient's name. What's that patient's name? What's that? And you just click on this and it's right at your fingertips. And then this is my favorite thing. This is called unlocking the opportunity funnel. Now in this diagram here, you see different offices. But what we do is we have it under different doctors. So for instance, if I had a cancellation of 2 hours, my receptionist, my treatment coordinator can go into my funnel and she can pull up the same thing. It's just another way of getting to a 2 hour procedure, an hour procedure. And she'll click on my name and then go in there and see. But you can also find, when I started in dentistry years ago, there used to be a saying that you have enough dentistry in those paper files to keep you busy to the day you retire. But what this is also from the business aspect, it shows me where my dentistry is in the office. And believe me, you'll see here we have 3,665 restorative candidates. We have planned 2,267, and we've performed 339, only 9%. If I had $680,000 sitting in my files, but you would be amazed at how much you do have sitting in your files when you do this. And you go in there and you look and you can find it. That's the beauty of this. You can actually find this. And then you can say view now, and there it is right before you, by restoration, by provider, and by procedure. And it talks about last hygiene appointment, next appointment, notes, and last evaluation by which doctor. And there is what we all want to have at our fingertips. We can also, when the patient leaves, we can print these out from their examination and show them, and you'll be learning these codes in just a few minutes, what exactly that means, each one of those mean. You'll be able to see how I show you can go in on a restoration and see the recurrent decay where it says 96% in Denton. We can send these home with a patient on printout so they look at it. Or if you know that you have a patient because you wrote a note that says, hey, I don't want to have multiple appointments, but when I come in, if there's an opening for me to have, I just want to make one trip to do a restoration and have this evaluation at the same time as my hygiene, that's the way. It may be a business person that has a hard time getting away. Then these are all in your AI evaluation. So the opportunity funnel protects you against cancellations. And if you have specialists, for instance, endodontists, periodontists, it can also, if you have them in the office along with the general practitioner, if it's a large practice, or you have them just in any practice, if it be a DSO or whatever, they can actually see and use this. You can also target market, like I want to do more endo, and you can actually analyze how much you've done. That's what that funnel allows you. So how about this though? This is Kim. This is one of my treatment coordinators at the Chicago office. And what the sign says is, I have been on hold for 20 minutes with your new patient's insurance company to verify benefits. I love insurance companies. How many of you can relate to that? Why? Why do we have to do this? We do it for our patients' sake. We do it to help them. And many of us can relate to this. If you have ever taken insurance in your office, which most of us have and do, then we can relate to that. And then, how about this? Now it moved from 20 minutes, as you can see on our little note there, 38 minutes and holding. Again, how much time in a day, week, and month do we spend dealing with calls to insurance companies? It's non-productive time. It used to and still does drive me nuts. Voila, no more. Key ingredient number 3, maximize your day. Be efficient in what we do. Plan. So how do we do that? Well, welcome to Pearl's pre-check, okay? And down in the corner there, I think my picture's covering up. But what pre-check can do is it can verify your patient's 81% of your patient's insurance. 81% of the patients can get verification by Pearl. And I will show you what it verifies, okay? It standard and walk-ins insurance breakdowns in 30 seconds live or on demand. So in 30 seconds, you put your patient's name, perhaps their social security company, their insurance company, and it can give you all the verification you need. It verifies your patient's insurance in the next 10 days of your schedule. It's an ongoing verification. And it has unlimited verifications. There's a lot of companies that you can submit to that you pay per verification that's out there. Also, it can verify each treated tooth as long as this patient's had the same insurance over the years, when that tooth was treated, what would it done, how long ago it was. So it gives you a history of explanation of benefits on a particular tooth. So all that in 30 seconds. The reason it can do that, Pearl pulls from 4 clearinghouses. It's different. So here's what happens. Insurance companies. It tells you the insurance company, it gives you the insurance remaining. It's keeping track. It can tell you if you have a patient come to you in June, how much money, have they spent already for their limitation? And it will give you the procedure that was done. Here, it gives you an explanation of benefits, what it will cover, what percent. This in itself is worth, for most offices, everything that you pay for Pearl. And if you see here the history, you can see the history of which particular teeth. So not only an explanation in the printout of different categories in dentistry or different diagnostics areas, but also what percent and how much has been used, and it covers everything. Here, it explains, again, the history and the service type. It verifies this, and it gives you your deductible. And this alone is just, like I said, I think it's worth every penny that you spend on Pearl. So let's go a little bit further and look at second opinion. And I'm running just a little bit late, so hopefully you give me a little more time. I would appreciate that. So I'm going to talk about second opinion. Second opinion is just what it says. It's a second set of eyes. And so what happens, it just tells us, hey, take a look there. Just take a look there. It's just a reminder. Again, can it be wrong? Yeah. But second opinion says, take a look. There might be something going on there. So here's our schedule. Real-time AI. So what it does is it looks back 18 months. Once you put Pearl in, it goes back about 18 months and looks at all your x-rays. And it will give you a diagnosis. It will give you an opportunity, as we refer to it. So as we look at this, and you look at tooth number 3, we all go to the screen and the monitor and we say to the patient, hey, see this area here where there's a filling? If you see underneath that dark area, that there's decay underneath that filling that is very close to that nerve. That middle part there is your nerve. We refer to that in dentistry as the pulp. We have all done this on either a computer monitor or a large TV monitor that hangs in front of the patient. We've all done that. And you have a little tartar down there. But you want to know exactly what the patient sees? They don't understand. We already know what percent they don't understand your x-rays. This is what they see. They have no idea. Now they sit there and nod their head, but reality is this is what they see. So what if we had a program, it's called Second Opinion, that can detect unbiasedly what's going on? And we show this to the patient. So for instance, the x-ray I just showed you, the pink area is decay. As you can see, it also can tell incipients. And the area of green box is calculus. The yellow is 2 to 2.74 millimeters. It measures bone loss. And depending on the bone loss, 1 to 2.5 is white. Yellow is after 2.5 to 4. 4 and beyond is a different color. You can set those colors, and you can see that it's telling us, hey, look at this area. This is what I see. Here's a better explanation. And if you hover over it, it tells you this is calculus. Again, we're going to zoom and we're going to educate the patient about this. And I'll show you. And then if you hover over this, it says enamel. It's incipient. It's all in, the caries is all in enamel. I was recently asked, are there some incipients that you have filled? I said, of course there are. It depends on the hygiene of the patient. It's all the patient evaluation. If you have a patient that is not caries prone, then I may use some remineralization in that area. If you have a patient that every day they go to school and they suck on Mountain Dew, I probably will fill this filling. So it's, it's again, a clinical decision, patient by patient. Okay, let's go on here. So here, a widened PDL. I'm sorry, let me go back. A widened PDL. It detects the widened PDL. And then, again, the readout of that tooth we saw in our previous x-ray, 7% cementum, 82%. And we can share this with patients. This is how I present. This is what I use for my patients. And I show them this because it points out the anatomy of the tooth. And I say to them, I want to show you the closer that you get to the green, the deeper the decay is. Once it's in that green and the inside where it looks red like heart, that's the nerve. We want to fill that once it gets to the green. And they understand that. So when you put a patient's FMX, you take it within seconds, you put it into, it goes into Pearl, then it gives you these codes. And you take a look at that. So what happens when I have a new patient, my assistant has taken this, I will study this before I go into the room and also when I present it to the patient. And here's our color codes. You will learn those. So how does AI really work? How does it work that this computer can see things that we can't see? Well, here's the facts. And this is exactly how it works. We as humans can see 55 to 77 different shades of gray. A computer's can see 550 to 750. That's the difference. So the slightest change, like if you're watching an incipient lesion, the slightest change, it can be detected. So when Pearl did the study, they gave the dentist the x-rays, and then they add the AI to the x-rays and diagnose 37% disease more detected. That was the results of that council. And not only that, it categorized where they found what the human eye didn't see, and there was an increase in diagnosis, and those increases checked out. So from a financial and 10 practices utilizing AI, on the average, the additional income was $12,500 per month. And here's a breakdown exactly of what that added finances came from. So $12,500 per month. Not only that, from the aspect of providing the best possible healthcare, look how much better this did than just without AI. And in specialty practices, in endo, there was a 26,000 increase because the facts are 49% of all periapical lesions are missed by the human eye. 49%. Study after study shows us. In the implant world, 2.4 thousand was an increase from the use of AI. So quickly, how do we utilize this? Well, this is Elliot. Elliot's a 28-year-old patient, a patient of mine, previous dentist. His wife's cousin was his dentist. Went to his mother's cousin was his previous dentist. Went to him as his dentist since he was a kid. And about 1.5 years ago, he retired. Well, his wife, who was a patient, might said, "You're going to go see Dr. Tomaro." He's not experiencing any pain. He kept his cleanings every 6 months. He is not a big sugar eater. His balanced diet. He works out. He's very healthy, eats a lot of protein, has a Mediterranean type, and not a soda drinker. Has coffee, has a little cream. I went through the whole diet. So when I met Elliot, I always interview my patients first. This was his x-rays. And this is what I saw. Now, what you can't see perhaps here is Elliot has a number of interproximal decays. He has fillings failing. So I had known Elliot for about an hour after the interview, after working him up, after doing a comprehensive exam. So, I'm stuck with a dilemma. Okay, you've been seeing a relative. It's been a year and a half, but this didn't happen over a year and a half. You don't have failing restorations. You have interproximal decay that is through the enamel to the dent. You have a good balanced diet. And so what are the predicament I am in? And if we look at these, you can now see these. So this happens. There's not anyone on this webinar where perhaps this has not happened. So what are the two major hurdles when treatment is presented in this situation? Number one, trust. And number two, money. So here's the alarming statistics. One, what percent of the patients return after their initial exam in the United States? The answer, 1 out of 2. What percent of the patients start treatment in the first year? 22%. These are the ADA statistics. Excuse me, I had to get a little drink there. What percent of Americans have $500 in their checking account? I just updated this, 27%. So again, trust and finances, that's what we face. So here is what bothers me more than anything. Well, the other bother me too, but according to the ADA, the average case acceptance rate is 70%. If you're good, it's 80%. So, oh, sorry about that. I don't know why that took place. A good presentation, 80%. So what that means is for every 10 patients you have, every new patient, 10 new patients you have, 3 walk out without accepting your treatment plan. That's horrible. I would not like that. So what I started doing about 35 years ago, and this is before I had these statistics, I had no idea. I started keeping track of my presentations because I wanted to be good at educating the patient. I wanted to be good at the patient accepting the treatment I recommended. And I just wanted them to know that they were in good hands and they were going to get the best treatment. So I started keeping track over 35 years ago. And on the average, every year, I averaged between 89 and 91%. I can accept that. But then when I added AI, when I added Pearl, it was 95 to 96%. So there's still, I saw a little biased opinion perhaps. Why? Your practice needs to offer an experience, not a crown. And I'm going to go through this. If the patient doesn't perceive the value and benefits of treatment, they're not going to accept your treatment. And what we all learned in dental school is we took every patient and we put them in the same box. When the patient calls in, the receptionist would say, well, you're going to come in. If you need x-rays updated, if we don't have current x-rays, we're going to take x-rays. You're going to meet the hygienist, and then you're going to have your teeth cleaned, and the doctor's going to come in and do an exam. Recently, I was asked by DSO because they were getting only 35% acceptance rate to help them. And the first question I asked them is, when do they meet the doctor? Every new patient in our office meets our doctors first. It's a must. What are we doing? We're forming relationships. We're forming trust. We let them know. And I'll ask questions like, is there any reason perhaps that you cannot accept the treatment I recommend? What am I asking them? I'm asking them if they can afford it. Is there any reason? I'll ask them other things. We'll do the health history review. I've already looked at that. When they came in, I looked at that before I go in the room, or we get it online. And I'll go over the health history. And I'll ask them their past experience. What is your past experience in a dental office? Have you had a good experience? But I also listen. That's the key. I listen to everything. What are your desires? Because they may want to have, I'll ask them, are you happy with your smile? They may say, well, I'd like some whitening. And we'll talk about that. So this takes me about 10 minutes. But yet we've learned to put them. So this is probably what I consider the most important time that you spend with a patient. So key ingredient number 4, maximize your day, interview, and build relationship. Everyone is different. Customized comprehensive exam. If I find out someone would like a smile makeover, I'm going to take some photos at that time. And then we're going to go from there and perhaps do things a little different. So we as a dental office, we need to stop thinking like a dentist. We need to start thinking and get the patient to see where you and your team are experts that they can trust. Be a mouth physician. Communicate the value. It's all about the attitude. Your attitude shows. There's no question. It's all about the patient. I always, when I'm lecturing and I'm going through an operative procedure, restorative procedure, I always mention to the doctor, there is a human attached to those teeth. We have to remember that. So the keys is establish trust, convey you and your team are experts, listen to the wants of the guest. That's how you get to 89 to 90% acceptance. You must, in order to present a successful treatment plan, you have to listen to their wants, and share with them what you see. There you will be earning their trust and form that relationship. So when you do it the old way and you walk in after hygiene and you've known them for 5 minutes and you present a $5,000 treatment plan or 2 crowns or whatever it is, it doesn't matter the amount. Why would they trust you? You only known them for 5 minutes. It's like asking your significant other to marry them on the first date. Many of you may have done that. Not me, but that's because I know what the answer would have been. So there's no relationship there. I can't emphasize enough how important it is. So here's our buddy Elliot. Again, this is what they see. This is how I present treatment or what I see on AI and my Pearl to the patient. Hygiene makes your life so much easier. My hygienist will go over this before I even come into the room for a periodic check. And then again, these are what they're detecting. These are, and if you notice the bone loss measurements, and you can customize that to your liking. So if we look, here's Elliot's, because I did a CBCT on Elliot, I take my vertical bite wings and we go, and they go through, this is them going through Pearl, and I hover over them. There you go. Again, I appreciate you giving me a little more time here. Hopefully you have found this interesting. So now you can see the anatomical part of the tooth. This is the part, even though I have the other parts and I look at it, these are the parts that I present to the patient and educate them. This does not take me long at all. You know, for many of us at Dexis, we increase the imaging. We do a clear view. You can do it right in Pearl. The contrast, you adjust the contrast. And perhaps you want to do something like zoom in. You can do that to show the patient. This is what's in Pearl. I can't emphasize enough how much simpler this has made our team's life in our office, and for many dental teams, how they can present, how the patient gets educated, how they learn from this, what's going on. Now you've taken the biased opinion of the dentist out of the dentist's hands, and you have helped the patient get a much better understanding. This is still our buddy Elliot. As I go through this, you can see what's going on there. You can see the interproximal, and we go from there. And I share this with Elliot. And again, no time at all. And there, hover over it, and it tells us exactly what part of the decay is indentin. And that's extremely accurate. I have to tell you, I mean, as far as accuracy, I have found it to be very accurate because I've checked it and measured it. So this was Elliot's chart when we charted out. This is your typical software, your dental software chart. And there you can see my findings. Again, by having that interview, by sharing him the AI, I built that trust. So here's Elliot, and I want to see if this will play. I would like everyone to meet Elliot. So Elliot, how long have we known each other?
About an hour.
So today is the first time we met, and we did a comprehensive exam.
Yep.
We took some what we call bite wing x-rays. and we took a CBCT. I did a comprehensive soft tissue, comprehensive dental exam. What did you think?
Thought it was good. I like the Pearl AI system. That was neat.
So Elliot, I showed Elliot our AI system in our office that puts all our x-rays through AI. Let me ask you a question. Compared to if we didn't have AI, did you have a better understanding of your x-rays with AI than you would have if we didn't have AI?
Yeah, I mean, the difference between the more superficial cavities and the ones getting into actual dentin, particularly the views where it's color coded, have been very helpful in explaining the call it urgency and importance of
Okay.
that. Yeah.
So I was able to show you how deep your cavities are, where you had some decay.
Yep.
And also where you had some, if there was any bone loss, which you didn't have any. And so would you say that AI definitely helps in a doctor-patient relationship?
When used like this, I think so, yeah.
Okay, well, super. Well, thanks for letting me do this video.
Sure.
Hey, Sheila, do we have 5 more minutes, you think?
Yeah, I think you're great.
Okay, super. So I just want to share with you. So the 2 major hurdles, if we revisit that, was trust and finances. Well, we've got Elliot's trust here, and this is just routine. This happens. Patients are blown away. So key ingredient number 5 to maximize your day, we have established trust and can further discuss finances, which we all should have some type of finance options in the office. So now you have the key to treatment plan acceptance of 89 to 91%, and with AI, 95. Maximize the day. Use that. So I just want to share with you just a restorative case here. This was I practice in Chicago every other week, Naples every other week. I know I'm crazy. But the application of AI in restorative dentistry, this is a PhD student in chemistry. And he comes in as a new patient, says, I got some sensitivity on the upper left. And I'm looking at the x-ray and you go, you think? So, he says, I have limited funds. I can do 1 tooth at a time. So I said, all right, so this is tough. So I look at these and I said, okay, so let's do this. So 24-year-old grad student, initial exam, extremely poor diet, excessive sugar, very limited, 1 tooth at a time. So what I do is I get in my Pearl and my 2D and I look at this and I'm going to have Pearl tell me exactly how much decay I have in dentin. And we do that. Pinky quick decay. So here it tells me. So I decide I'm going to do tooth number 13. So now I don't want to pulp out, right? So I take Pearl and I can measure very accurate. So what I did was, we know that x-rays, the decay can go a little bit. I measure the distance of the last part of the decay closest to the nerve to the pulp on the mesial. There it is, 1.07 millimeters. I'm not going to pulp out. I measured on the distal, 1.2 millimeters. I'm not going to pulp out. Here it is in our color tooth. So this is what tooth number 13 looked like. Again, the goal, avoid pulping out. So I decide, okay, ahead of time, I'm going to, I don't know if many of you are familiar with Sarah burrs, but when I was in dental school, they said, take the largest carbide burr to do your caries removal. I know there's caries dye detector, which I'm not a fan of, but this burr upsets me because I didn't invent it. It's ceramic burr. It's genius. It only removes decayed tooth structure. So I prep the tooth and I'm going to maximize the strength of the tooth. Now I understand there's a lot of people, it'd be easy just to do a crown prep. That's not the way I operate. I want to save as much tooth structure as long as it has support. I'm huge on the occlusion, has support. This has plenty of support. So I maximize the strength of the tooth. I use my Sarah burrs. And the final thing, which most operators forget, is I bevel all the margins. I bevel them so that the composite meets it and it can just like flush. It can flow right into that bevel. So I use this burr usually a lot of times to place my bevel. It's the last thing I do, but I need to protect the pulp here. So I place the calcium hydroxide, and, and the reason for that is it's antibacterial, it can seal dental tubules, it causes remineralization, and it protects the pulp from, potential harm, whether it be temperature or whatever that trauma, not so much trauma, but can protect it chemically from any type of harm as it remineralizes. So what I do is I remove any excess calcium hydroxide with a finishing burr. So I dampen a micro brush. I dampen the area I'm going to apply it. I syringe it out. I light cure it, and then I'll remove any excess that perhaps got on the cable surface margin. I'll place a sectional matrix, ring in wedges. I'll do either selective or total etch. I'll rinse. I'll dry, leaving slightly moist. And then I'll apply a universal bonding agent. I scrub the living daylights. And this is where most dentists, I would say, if they have sensitivity, they somehow do not, or they sometimes do not scrub that dentin as much as they should. I really scrub that into the dental tubules. And then I'll use a self-leveling flowable and light cure it, and I'll layer it with my final. So we went from this before, and this is our finished product, and I'm huge on anatomy and polishing. And finally, one of the things that I'll use is a number 12 Bard Parker scalpel to make sure there's no overhangs. I'll make sure that that cervical area deep down in the gingiva is nice and smooth. This I do routinely. And real quick, our next patient, I was doing an exam, and one of my things in life is to help teach younger dentists. And so this is a dentist that had placed this filling a year before, very young dentist. And this has happened to all of us. I don't care how long if you've been in dentistry 10 years, this has happened to you. And so I look at this and put it in pearl, and I go, whoa, that was placed a year ago. There's quite a bit of recurrent decay there. And then as I hover over it, you can see it's 90%, 98% in dentin and 2% in enamel. And then if I go back a year, and at that time, I put the previous year in pearl, it's 100% in enamel. So the question is, did it really need being done? And I get it. We're darned if we do, we're darned if we don't. Again, complete patient evaluation. High risk caries patient, I probably would have filled it. But what actually made the failure? What was the reason? Here it is, magnified. There it is, tooth color a year before. So this is what it looked like clinically with an intraoral. What caused the failure? Well, I've had answers in lectures from everything from the adhesive, the bond, the prep design. No, not at all. This is what caused it. The opposing cusp plunging into that is what caused it. And I will tell you, in the amount of years that I've been doing dentistry, I can honestly say, yeah, I've had that happen a few times. Is that the opposing cusp, even when I checked it, but when they go into function at home or wherever, it fails. So this was the final result. We fixed it. The dentist, she felt terrible. I said, don't feel terrible. It's a learning process. I always said, no one died here. It's a learning process. But it's something to take a look at. Always take a look at the occlusion. And with Pearl, I could tell that we were going to be able to replace that restoration. So the benefits of AI allow you to maximize your day, faster and more efficient workflow. Predictive analytics for patient outcomes, improved accuracy in diagnosis, enhanced treatment planning, personalized treatment options, and results establish trust and build relationships. That's the beauty of what we do. That's the beauty of presenting a non-biased AI assistant diagnosis and also building that relationship with that interview. So conclusion, schedule to production. Resources, have your resources. When your schedule changes, whenever you need to fill a schedule, whenever you want to achieve your goal, whatever that is, be efficient with the pre-check, as I showed you in the insurance interview, build that relationship and trust. And the fifth one, establish trust and build relationships. So that's a lot of information in an hour. Questions, Sheila? Sorry,
Tomorrow,
there's
that's
a lot of information I
good.
want to get.
I know. I want you to keep going. There's so much information here tonight. Thank you so much for
Yeah,
sharing all of your information with us, all of your expertise, all these, like
thank
I
you.
was saying in the beginning, tips and tricks. Um, I do want to open it up for questions. If I could share my screen for just a moment while everybody begins putting their questions in the chat. Let me see if I can share. I think I have to have you stop sharing for just a second.
Okay.
Perfect. Okay,
All
great.
right.
Awesome. Okay. So what I want to do now is just open it up for questions for those of you that are still here. I do want to let you know that we are allowing teams to do a 30-day free trial of Second Opinion. So by scanning this tonight and setting a demo, you will be eligible for that. So if you have any questions, happy to answer those questions. It looks like there's a question in the chat here. Let me see. Great question. So can Pearl AI detect a vertical fracture?
Yeah. So
So
one of the things I lecture on is 2D versus 3D. All right. You know, a vertical fracture is very difficult to diagnose in 2D. At this time, we're working on it. It's very close. We're working on 3D x-rays into Pearl. I mean, we're very close. So from a 2D x-ray, obviously, if it's extreme split vertical fracture or extreme split horizontal fracture, it can see that. But most vertical fractures, as we all know, are not. But it's coming. I promise you, it's coming.
and whoops, I'll go back. And one more question was, how fast does Pearl work in real time? So when you take x-rays, how fast can you see the images, doctor?
It's less than 30. What is it? I think even you know that less than 30 seconds. I mean, the minute you put it in there, it reads it. You know, with the FMX, I give it a couple of minutes. I mean, it's you get your results immediately.
Yeah, I think that's important for everybody to know. I think as well is we do have native integrations, so we are embedded in some of the imaging systems. We are compatible with most. And being able to have quick images is very important, right? When you're taking, like you were saying, working length for endo, if you're taking images there, you need to know right away, what is this looking like? Or your hygienist is taking 4 bite wings. We want to make sure by the end of that 4th bite wing, if you're still using lead aprons, that comes off, your AI analysis is there. Those images live inside of Pearl as well. Now,
So one of the things I was going to say also that I didn't, I said, you know, it's a fact. It's studies show 49% of periapical lesions in 2D X-rays are missed. Also, a fact is over 25% of carious lesions that have been diagnosed without AI are not carious. So anyone who's been, and I asked this in lecture, I go, okay, the doors are closed, no one can hear us. How many of you have ever prepped a class 2, an interproximal filling prep, and there's no decay? And I raise my hand immediately. I've been at this a long time. I'm guilty of that because again, we we learn to diagnose and we rather err on the side sometimes, depending on the patient, of we're darned if we don't, we're darned if we do. So it happens. That is one of the things that you can eliminate is with AI. There's no question. And it does require having a nice x-ray. Okay. I mean, it can diagnose some overlaps, but yeah.
yeah, I think it's important for what you're saying to be really kind of reemphasized is that in our FDA studies, we noticed that Pearl plus the clinician yielded the better results. It wasn't just the clinician, it wasn't just the AI. So I think that was really, very insightful for us to look at, as well as that consistent concern we have with feeling like we have to infuse trust back into the dental space. I remember as a hygienist, I used to hold up pencils, like this is where your bone level is, this is where it needs to be, on the x-ray. And we don't have to do that anymore. So I think it's really important how you've shared your team kind of seamlessly integrated that, and you were able to have the hygienist be there to really kind of warm that patient up, have those discussions. So
Right.
that's
And
been helpful.
yeah, and one of the things we're starting to do, Sheila, as you know, is we're able to submit the AI bone readings to insurance companies to get SRP verification and periodontal therapy. So that's happening pretty cool.
Yeah, that has been a real game changer for teams because they're submitting these images in addition to their probing depths and in addition to their narratives. Um, but having the bone level measurements on there seemed to be the big game changer between, getting claims paid, or even a bunch of our teams used these images just by taking a screenshot of those bone level measurements, and they sent them in on all of their SRP denials. I'm not sure if it was you, Dr. Tomaro, or another doctor I spoke with earlier this week, but they were talking about how the insurance company wanted them to submit the time the patient came in and the time they left, and how
Mhm.
long the duration is of that scaling and route planning appointment. So again, proactively giving the insurance company as many images and AI help as you can, more likely the patients are going to have
And
less calls.
the beauty of that is at the push of a button. Click.
Simple.
Yeah.
Any other questions you guys have, feel free to put those in the chat. And then also, I think one last question is that we get asked a lot is, what about implementation? Like, we don't like change, right? But how does this learning curve work for your team? How was it? Were you able to, I mean, there's a lot of colors here. Give us some
Right.
information about
So what happens in many dental offices, the doctor will go to a weekend seminar, come home, say, hey, we're going to start doing this. And the team looks at, I mean, I talk about this all the time. The team looks at each other and they go, yeah, that'll be a few days. We'll be right back to where we were. No,
that.
no, the team was so excited because when I showed Kim what we can do for insurance, and she doesn't have to hold that sign up 38 minutes on hold. And let me tell you how many times that all of a sudden you hear a dial tone because they didn't take your on hold call and you have to redial. So, I averaged it out where in an office that gets, let's say, 15 new patients a month or 20 new patients a month, which, many offices 10, 15, 20, there's a waste of 2 to 3 hours a month, if not more. I'm being conservative in what I've studied. 3 hours, even 2 hours a week, and sometimes in our practice, that is non-productive. And yet, from a business point of view, those people are getting paid that, and they hate it too. Because who likes to be on hold? And when patient can walk in and in 30 seconds have insurance verification in over 80% of the insurance, I said that alone. I shared that with them. They go, we're getting it. The hygienists love it. I mean, the hygienists, because again, I want to make sure everyone understands, and you said it earlier, the doctor is still needed. The doctor is the ultimate decision. All AI does is, hey, perhaps something was missed here because you couldn't read that x-ray because of your limitations. Perhaps um, we're going to go from there. But yeah, so good. We're good.
Excellent. Well, I just want to thank everyone for joining us. Really, Dr. Tomaro, thank you for really kind of walking us through how your team's been benefiting
Sure.
with Pearl. And I encourage you to think about using AI in your practice. Obviously, we're a little biased to Pearl, but it's a real gift for your staff and it's a huge gift for your patients. You're automatically infusing trust, that case acceptance increases. They understand what you're talking about, which leads to them accepting dentistry earlier, more often, building a very happy experience, a more retained patient, and also just thinking about the fact that your charts are already audited and you have a full provider view of your entire day before you ever arrive, and your patients are verified. You're still going to call a few, but that's been a big gift that we're giving back to the teams. And last time I checked, we don't have an influx of team members joining dentistry. So we all need a little extra help.
So Sheila, I don't know if this is up on the screen. I wanted to let everyone know, is my email and cell number on that?
I don't see that. Do you want to share your screen and go
Yeah.
ahead and put that up?
Yeah, let me see. How do I go back here?
And then don't forget about the code. You must insert the password, which is Pearl, for your CE
I
certification.
don't see where I can share. Right. Wait a minute. Wait a minute. Sign in, recording, video.
Just bottom, I think the green button, that one was your screen.
Right here. Nope. Is that it? Nope. I gotta go back. Let me do this. There we go.
That is the
Now
Zoom.
now I will. There you go.
Oh, beautiful. Okay, perfect. And then pop
So
to present so we can see it nice and big.
there you go.
Thank
So
you.
I always put this out no matter where I lecture, teach. Anytime anyone has any questions, this is my email address. And I really mean this from my heart. I learn from everyone. I like sharing. So anytime you have questions, whether it be about Pearl or anything, these are my contacts. I don't care if you call me. If I don't get back to you right away, I promise I will get back to you. I mean, so this is my cell phone number. I love talking to my colleagues, hygiene assistants, they're all colleagues. And if you have any questions, I'm completely honest. I don't own any part of Pearl. I wish I did, but I don't. And I'm completely honest. Sheila knows that. It's like, if there's something I don't like, I will let you know. And, that's the only way to be. But this is anytime. Okay.
Well, I thank you for
Thank
offering that
you.
up. And people
Yeah,
should definitely take
sure.
advantage of that because you have so much knowledge. And again, thank you to all of you who stayed very late and really to you, Doctor, for prepping this and sharing your wisdom with us. We're really thankful you spent time with us tonight.
You're more than kind. Anytime. You know that. I love it. Take care, everyone. Have a good
Bye.
evening. Be safe.